I'm Brandy Hubbard. I'm head of training at Safe Lives.
Belle Phillips. I'm head of innovation for Safe Lives.
I'm Raisa. I'm a drama therapist.
My name's Koya Conte. I am an African-centered therapist, a drama therapist, and a therapeutic wellbeing practitioner.
My name is Michael Melody Luke, and I'm a drama therapist.
I'm Dawn Monroe, and I work in the domestic abuse sector.
Brown. I'm a psychotherapist.
Seeing Judy has really helped me to reflect on where I am, and that it's really kind of holistic and very trauma informed.
She finds that perfect balance between listening and responding and guiding without telling me what to do. And it's incredible how she very easily helps me to see things that are kind of just there but I can't quite see.
It's really nice to have a supervisor that sees you and your clients for who they are. And I think working with clients from different cultural and religious backgrounds and appreciating their differences, their uniqueness, and actually having a real appreciation for it rather than a judgment or an assumption or a not knowing.
It was just what I needed in order for me to do the work that I was doing with the community that I was working with as well. So
I need this space. Sometimes I'm like dragging myself, and I always leave more energetic, with more understanding about my current situations, more empowered.
I remember at first when I started supervision outside Therawake, I didn't really enjoy the whole process of it. And then when I did start with Therawake, it was really different. It just felt really natural and really helpful. It feels like
group supervision that I had was white-led, and so I didn't see myself in that supervision group, and some of the concepts, the things that we used, I felt alienated. That was the difference with doing supervision with Therawake. I was seen, I was heard, I was felt.
It's different because of how it makes me feel, and I feel very heard. It's on the one hand a very nurturing experience and space that she creates, but also challenging. She's also able to help me navigate through some really difficult situations and give me the confidence to be able to work and function differently in those environments.
It's the safe space that I think that professionals that work with people and with the depth that people and families bring. So I think having somewhere to put it, somewhere safe to put it, where you know you're not going to be inundated with other people's opinions of how you should have done your job, and more a space to really think and pull apart and analyse and offload safely and confidentially is really, really important.
I think people who are working with others experience vicarious trauma, secondary trauma, and we don't actually recognise or understand the impact that our work is having on us mentally, physically and spiritually. So I feel like having clinical supervision helps us to have that space to understand the impact that our work is having on us and unpack that. I think for people that recognise that work is having an impact on them, it's really important that they have a safe place to deal with that and look at that with a qualified person.
Everybody needs it. If you're working in therapy as a therapist with clients, it allows me a perspective sometimes on what I think I understand clearly, and then I come away thinking, oh, but there's more here.
I value it so highly that I've said everybody in my team has to have it.
And I already recommend Judy to everyone. I'm really pleased that she's got Therawake and the Therawake directory, because it's like another trusted source for us, for our communities to go to.
Clinical supervision and therapy as well. I would definitely recommend Therawake supervision to others because, second to none.